Hi, I'm Heidi Bassfield, Executive Director of Speak Our Minds and Speak Our Minds podcast. Suicide remains the leading cause of death for our nation's youth. It's nothing short of a continued public health crisis. And on this series, we wanted to team up with providers and talk about what children's hospitals and our teams throughout this country are doing to take on this challenge and work every single day to have things be different, better for our youth. As part of this series, you'll hear from those providers, their teams, and what they're up to. They'll talk about new practices that they're putting into place, what they think has changed about the conversation with youth mental health, what their biggest obstacles are, what they would do about those obstacles, and what they're really excited to be a part of over the next 5 years. We also feature stories from parent caregivers who really bring home why this work is so incredibly important and how we can all join and be part of these efforts as a collective to turn the tide and prevent youth suicide. Thank you for joining us for Preventing Youth Suicide, a series focused on bringing about change. Hi, friends. I'm here with Micaela Thordarson, who is our manager of acute outpatient mental health services for Rady Children's Health in California. Okay, Micaela, here's your big question.
Yes.
If you could wave a magic wand and fix one single obstacle for youth in the mental health space, what would it be?
I think it would actually be having guides. The navigation of the mental health system of care is dismal, like to a seemingly like criminal level. And I can't even tell you how often we have families who come in and they're just so lost.
Yeah.
And that feeling of loss, that like confusion, delays accessing care to such a degree that kids become so much sicker and feel so much more hopeless.
Right.
Because I can't find a therapist. By the time I get a therapist, I don't even like them or they leave. And now I need the hospital because I was untreated and I gave up hope. And so by the time they even connect to services, they don't even have a lot of belief that you're going to be able to do anything for them. Yeah. And so if we could have kind of like guide or navigators, another term, right? Yeah. Where instead of call your insurance company and look on the website and try to find us, if you just had a person who was like, here's where you start, and then is going to check in with you. Did someone answer the phone? Did someone call you back? Okay, here's what you need next. Yeah. Because otherwise they have no care or they just end up in emergency departments.
Yeah. Does it matter where the guide or care navigator lives, so to speak? Like, do they need to be tied to a hospital? Do they need to be tied to a school, a community setting? Like, in your mind, giving it a little more thought in this magic wand waving space, where do you think that type of role should live?
So my immediate thought was the payer, like the insurance company, because that's the one who knows who you can actually access.
Yes.
Right?
Yes.
Because families come to us and they say, you're a reputable organization and you know things. Yeah. Could you tell us where we can go?
Right.
And we're like, well, I can't even look at specific Blue Cross, because Blue Cross has 10,000 different kinds of plans that panel people all differently up a list of like, well, if you have this insurance, here's the people you could go to.
Sure.
And so it feels like the payer should be the one supporting the navigation.
Sure.
I also feel like maybe that would have already been in place if that was a thing that they were motivated to do.
Right.
And I can see that there's an inherent conflict of interest there, potentially.
Right.
And so I think trust is the next thing. Is like, it's not just the insurance, but then the problem is like, it has to be a body, an entity that's employing these people or that's giving these people to the communities that people are going to trust, because you can put a phone number for people to call.
Right.
And if they don't trust who's going to answer that phone, no one's going to pick up the phone and dial that number.
Right. That's great. I totally agree. All right. So here's the other big question.
Okay.
Looking ahead, what do you most want to be a part of building over the next 5 years?
Oh, wow. That feels more overwhelming than a magic wand question.
I know, we like to think aspirational.
I'm trying, like it's easier to think magic because as soon as you ask that, it's like, well, what's reasonable? what can we achieve in the next 5 years? And then it's so easy to get stuck in the barriers.
Yes.
Right?
That
come up.
Maybe keep the magical thinking.
I'm really good at magical thinking. So, okay, I will say I want to be a part of building something in the next 5 years, because let's do that. Something that feels quality-based and independent from some of the whims of funding. I think we're in a time right now where all of a sudden healthcare is becoming potentially inaccessible for swaths of people.
Right.
Or the kind of healthcare people want is now being dictated
Yeah.
in ways that feel wrong.
Right.
At its core.
Right.
The people making choices are not the people that affect everybody, are not the people who are most qualified, most knowledgeable, most aware, have training. And it feels like we need to build something that has a little bit more independence.
Yes.
So that as because things change is a part of life that we need to be comfortable being uncomfortable with.
Yes.
How do we at least preserve a core of access, of quality, that we can that everybody can come to the table and agree.
Yeah.
These are the things that no matter who has the different powers and whatnot, this is what we're going to do, and this is what we're committed to as a population.
That's amazing.
Yeah.
All right, friends. Well, you heard it here. So thank you, Micaela, for joining us. And we'll be excited to see if Micaela and her magical thinking become reality in partnership, obviously, with so many wonderful people that are here with us.
Yes.
Thanks for joining.
Thank you.